We're learning about a new study that shows the U.S. is seeing more cancer cases in younger age groups. 9 News medical expert Dr. Payal Kohli is joining us this morning. Thanks for coming in.
Good morning. What a scary study.
Yeah. It is. So this study shows we are the first generation to have more cancer than our parents. Talk a little bit more about that.
Yeah, so we've been seeing cancer rates go up over decades, but what we were seeing is by generation, they were going down. So our grandparents, for example, had the highest risk of cancer, followed by our parents. And unfortunately, it sort of went down with our parents, the baby boomers, and then it started to rise again with us, Generation X, which is 1965 to 1980. So this study is a real big eye-opener because we thought we were beating cancer, just like we were beating heart disease. But what we're seeing now instead is actually a turn in the wrong direction, cancer rates going up in young people.
And obviously it's asking the big question, why that is.
Yeah, so there's lots of reasons. So first reason, which is most obvious, is that people are living longer, right? So if there's more people around, then more of them are going to get cancer because cancer is a disease of the aging. The second is, are we getting better at technology? Are we just detecting more cancers that we perhaps could have missed? These are sort of the benign reasons, but really the one that concerns me the most is that we as a generation are exposed to more toxins than ever before. And we're thinking this is the main driver. And we're talking about environmental toxins, of course, but also toxins in our food, ultra-processed foods. We're talking about our lifestyle. We're more sedentary, we're more obese, we drink more alcohol, we smoke more marijuana, and all of these factors put together are actually changing our genetics and turning what used to be a disease of aging now into a disease of young people.
Yeah, it's so scary. Are there certain cancers that we're seeing more of an increase and any that we're seeing a decrease?
Yeah, so this is what's interesting. So if you think about our systems that excrete toxins, our GI tract, we're seeing an increase in cancers in those systems. So our stomach, our pancreas, our gallbladder, colorectal cancer, of course. Also our GU tract, our urinary tract, so kidney cancers, prostate cancers. We're seeing increase in breast cancers and thyroid cancers. Now we have made some progress in lung cancer because the smoking campaign has been very successful, and also cervical cancer because we now have a vaccine. We know that's a cancer caused by a virus, HPV, and we can vaccinate individuals against that virus.
So, of course, this perked a lot of people's ears up, and now we want to know what we can do to prevent cancer.
Yes, so, you know, We've sort of figured out the recipe for heart disease. Now we need to tackle cancer, and this means all hands on deck. And I would say it's never too early to start talking about cancer risk because we're seeing 20-year-old college kids coming in with cancer now. So talk to your doctor about when you should start screening, particularly in the context of your family history. Even though we like to think our body is resilient, we can do whatever we want to it when we're young, treat your body like a temple. Okay, worship it because you don't want to put toxins in it. Try to minimize alcohol intake, marijuana intake, and really try as much as you can to adopt a healthy diet, healthy lifestyles, staying away from those TV dinners, those processed foods, which can be so easy to eat, but really are full of a lot of carcinogens that can lead to these types of cancers.
It is scary, but there's a lot that we can do. You were talking about the processed foods and the alcohol, but like being more active too. I mean, it's such a big part of like this healthy lifestyle that can help you down the road.
So important to be active because when we're active, we release chemicals that are good not just for our heart, good for our mental health, good for our cancer risk. And then sleep is that other one that we always chip away at, all of us do. But sleep is when our cells repair the damage that they've accumulated during the day. So cancer is essentially accumulation of mutations and damage in our cells. And by getting enough sleep, we really do give our body an opportunity to heal itself.
All right, that's all you have to say for me. We're about to go to bed at 5 p.m. every day.
I wish.
Dr. Kohli, appreciate it. Thank you very much.